I think we're ready, and Donna is actually going to start out, and I'm going to move the slides forward by her command.
Okay. Well, let me just reiterate what Priscilla said earlier. There has been a group of us working on this, and so I really want to give a shout out to Priscilla, of course, and Diana Borges and Diana Urban, as well as Nancy for the presentation. And we hope you find this informative, right? So, okay, Nancy, let's go to the next one here. So we thought it would be a good idea to start with a little bit of context. The older adult population, as I'm sure you may be aware, is really quite diverse. And it's diverse regarding socioeconomic status, education, ethnicity, culture, race, living arrangements, and so on, among many other characteristics. And obviously, in this presentation, we're not able to deal with all of the variety that exists. So what we're going to do is we're going to offer basically some generalizations, right? Acknowledging that we may be missing some of the texture and the character that characterizes this population. Specifically, we're going to focus on older people living independently rather than in congregate settings or multi-generational households. Right, Nancy. So older people are more vulnerable in emergencies. It's not that age itself per se alone makes older people more vulnerable. However, there are some limitations that are more common in older adulthood that can pose problems for people. Mobility impairments can make evacuations difficult. Hearing impairments can make it hard to hear warnings and to get information about emergencies. Social isolation can make it hard to ask for help or to be visible sometimes to first responders. Power outages can affect medical devices. Sometimes cognitive impairments can make the planning and evacuation processes more challenging. And the disruption of support services that people depend on can also make more complex emergency situations. Okay, Nancy. So we want to add to this the fact that older people tend not to be prepared for emergencies. When I started getting into this, I saw that older people are not prepared, but I thought, well, I'm not sure this is entirely different from, most people in the population. But suffice to say, results from national surveys of older adults has shown that less than a third had an emergency evacuation plan. Less than a third had participated in disaster preparation training or a program of any sort. And in some ways, surprisingly, less than a third even knew how to turn off their gas. Only a quarter knew of a program or organization that helps people prepare for or handle disasters. And more than a third didn't have a basic supply of food, water, or medication in case of an emergency. Nancy? However, older people do have resources that can be tapped for preparedness in emergency situations. Okay. Again, results of national surveys have indicated that over 90% of older adults had a car, and of those without a car, 70% could get transportation in an emergency. 75% of adults over 65 years live within 30 miles or less of an adult child or other relative. We tend to think sometimes of older people as being, geographically or physically isolated, but in fact, most older people live within a reasonable distance of a relative or adult child. Over 90% had someone living within a 50-mile radius who could provide shelter in an emergency. These are obviously all significant resources, but the most important resource of all is an older person's resilience and a lifetime of experience in solving and coping with problems. And I like to say and think that people don't get to be old who are clueless, careless, helpless, and oblivious to the challenges in their environments. Okay, Nancy? So older people should certainly be engaged as partners in the preparedness process. Older people have agency. It's important not to plan for older people, but rather to help and guide them in planning for themselves. There can be a planning team that includes the older person, family members, neighbors, caregivers, other professionals. But it's important that the older person is, if you want to think of it this way, that the older person is the captain of the planning team. So essentially they need to be in charge of this process. And that's important because in the final analysis, when an emergency happens, the older person has to be invested in the plan, know what it is, and know how to execute it. And that's ultimately going to be the older person's responsibility. Nancy? So communicating effectively with older people in many ways is pretty much like effective communication with anyone. You want to engage in an interactive, respectful, reciprocal exchange. We need to make sure we avoid patronizing language or endearments. Many older people, and I am one here, I do not like to be called honey, dear, darling, and such things. I suspect that's true of many of you. It's important to speak clearly and directly and to make eye contact. If a person does have some hearing impairment, then being able to look at you when you're talking is important. And that's something that we've learned, unfortunately, about the pandemic with ubiquitous masks, is that it is often more difficult for those with hearing impairments to be able to communicate as they once did. Don't speak particularly loudly or slowly. That can simply be annoying, and it's often counterproductive, and just increasing the volume does not help people with hearing impairment understand better. Just basically speak clearly. Be concrete, be specific, and it's also a good idea to ask open-ended questions when you're having a discussion and an exchange with people, rather than always just asking sort of yes/no questions. Yes/no questions tend not to engage a person very much in the process, and the whole point here is to engage older adults in this planning effort. Using visual aids is always a good idea. It helps to clarify content. And people of all ages have different learning styles, and often, some people are more visual or more tactile. So it's good to have that available as you're interacting with someone rather than just talking with them. And finally, it's also a good idea at the end to verify that the person has followed along, has understood the information. And one of the ways of doing that is to just sort of ask them how they would use the information that you've been focusing on. Okay, next, Nancy. So meeting with older adults for preparedness planning, it's important to be flexible and to be accommodating. You can offer different types of venues. A person might prefer to meet in person, maybe over Zoom. We've all gotten very used to that, haven't we? FaceTime is another option for some folks. If you are meeting in person, make sure you offer to wear a mask. It may be a really good idea to be willing to meet more than once. If a person is somewhat more frail, a morning meeting might be an especially good idea. If a person seems to have gotten tired, or if there have been lots of questions and you haven't been able to get through all the information, it might be a good idea to reschedule a follow-up appointment. And if so, make sure that you make arrangements for that before you conclude the first meeting. And finally, you can always offer to include other people in the preparedness planning meeting. I mentioned earlier that people can certainly have preparedness teams, and that could include other family members, caregivers, neighbors, what have you. Okay, Nancy? So at this point, for purposes of discussing the personal emergency plan, I'm going to turn it back over to Nancy, who's going to take over here.
Thanks so much, Donna. That's such great information. And I really learned a lot working with you and developing some of this information and how best to work with our seniors. So one of the things we want to do is we want to ask some open-ended questions about people and how they're living. And this will help us as we're working through a plan with an older adult to identify things we need to focus on. So whether or not they have hearing problems that might prevent them from hearing a siren or a warning, which would mean they would need a neighbor to help them make sure that they had the information they needed should there be an emergency. What kind of news sources they have. This can also give you a clue about whether or not they're going to need additional information from neighbors in order to be situationally aware. What their mobility problems might be, whether they have specific medical equipment that they rely on, if they have caregivers or other services that might lend a hand in an emergency. And also, you know, sensory wise, can they smell smoke? Do they have a good enough nose still that if there was smoke, would they be able to smell that smoke in the air? We're going to talk now just briefly about focusing on if you went to one of these neighbors with all this information in hand and you had an evac pack with you, kind of what it would look like to go through a personal planning session with a senior. So we're talking about, first of all, looking at the personal information, and you'd want to explain to them that this is helpful if for some reason they're incapacitated, if they're not feeling well, that a first responder would have this important information with them. If they have a longer medication list, you can certainly suggest to them that if they have that list, they could just attach it to it. They don't need to be writing all of this information down. And they might not want to go over this information with you. So you might suggest that you'd be happy to check in with them later about this information. And then, you know, you could provide some accountability for them to actually do the task. And then you could check in with them and help them fill in the blanks if they've missed any information along the way. On the second page of this is that contact information. And so in addition to the contact information, this is a great opportunity for you to find out if they're signed up for SoCo Alert and Nixle if they have cell phones. So you can drop that information in and even help them sign up on the spot to make sure that if they do have a cell phone, they can get this information alerts on their cell phone, and they'll really appreciate that. And then also discussing other information, NOAA weather radios, websites that you like to get more information on. I know watch duties become very popular as well. So just the different things that you think they might find interesting to help them stay informed. And of course, if appropriate, offer to be one of their contacts on this. So somebody else local, and get your phone number down there, or somebody else that's their neighbor, so that they have a hyper local person that they could call if they need assistance in an emergency. Now, the go bag section might look a little bit overwhelming, as well as that shelter in place section. So it's good to focus on the things that they have around the house as well. So, you know, everybody has some bottled water maybe around the house, or maybe they already have a flashlight. So, you know, trying to pare this down so that it doesn't look so daunting, and offer assistance to help gather some of these supplies if it looks a little bit overwhelming for them. The other thing is you can discuss with them the really important things. So if they have life safety medication, you know, maybe sussing out with them how they might get a few extra pills that they could keep those in their go bag and rotate them a couple of times a year so that they have that supply ready already in their go bag, stuff like that. And then, you know, what types of small items that are precious to them that they might want to be able to pop into their go bag before they left. So having that on the list for them as well. So just trying to break it down into the things they might be most interested in discussing at that time. But then again, also offering to come back at another time and suggest that, you know, we can go over the list later after you've gone through what you have at home. If you need help gathering those supplies, you know, I'd be happy to help you with that after you've exhausted the resources you have. The shelter in place kit, again, identifying the items that they already have in their home, and strategies of getting some of the other items over time. So you don't need to get this whole list right now, but you know, what would look good for you? Would it be good for you to maybe buy one extra can of goods once a week? And so you're slowly building this shelter in place supply, or, you know, this week you can buy this thing, and maybe next month when you get a check, you can buy these other things. So, you know, stressing that it's not something that has to be done overnight. It can be a project. A lot of people that are on the older spectrum also love to have a project because they don't have a lot of things to do. So making it a project also will help engage them and be interested in doing this. And explaining the importance of this shelter in place kit. As we know, it could be really important. For instance, at the beginning of a pandemic, everybody who had 7 days worth of supplies in their home did not have to go to the grocery store immediately when it was announced and expose themselves to everybody in the grocery store, which is what we were calling the shelter in place for in the first place. So having those supplies on hand is going to be important, and you can help them see the importance of that. And then the evacuation section, which we know is also a very scary thing, especially for people who are low on resources and may not have a plan A or a plan B and not really sure how to devise that. So immediately being able to offer that the COPE group that they are in the neighborhood of has resources for them to help back them up, and that, you know, if they are going to need help in an evacuation, that, you know, that there's a number of different neighbors that you can put them in touch with and work with to try to help become part of their plan A or their plan B if their plan A falls through. Also, how they're going to get that warning and what their evacuation zone is. So again, because in this pack, they do have a know your zone sticker, you'll be able to look up their zone for them and write it right in there for them, so they know that when they're getting this information, that there's an evacuation, whether or not it's their zone that they're in or not. So these are all really important things. And then also in that evac pack is the checklist and the evacuation information. So these, again, a lot of these things that are things that you can do if you have more than 1 hour. Many seniors are going to be at a loss of doing some of these things. So is there someone in the neighborhood who can help them make sure their hose is hooked up? Is their neighbor already going to be leaving a ladder out? So don't worry about the ladder, because your next door neighbor has a ladder they're going to be leaving out. So if firemen show up, they can help you. They can help your house by using the ladder that's being left next door. So, you know, just trying to make these things easy. And then, of course, the evacuation tag and what they might do with that evacuation tag if they're going to evacuate. One more thing that's in that pack, of course, is the public safety power shutoff. Now, if you're talking to a senior who does drive, suggesting to them about being sure to leave their car out of the garage if there's a red flag warning, some of those things, this is a good time to talk about learning how to open your garage door. So not suggesting that you would go through all of these things at once with somebody, but these are all great conversation points depending on who you're talking to and the things they tell you they're concerned about. These are all places that you can segue into good conversations and track changes and give them confidence that they have a community with them and behind them that can help support them should there be a disaster. So we're going to now switch back to Donna, who's going to talk about wrapping up the meeting.
Okay. Yeah, okay, that's great. So we mentioned earlier that it's a really good idea to sort of verify that the person has kind of understood all the information that that you've been discussing. So this is one of the reasons why sort of engaging in this kind of wrap-up summary conversation is a good idea. And the purpose is to reinforce important points and to just ascertain that the person you know, has sort of followed and learned some of the important things that you've been talking about. And so if you're going to have a conversation with someone, perhaps it might begin something like this. You could say, you know, something like, we've covered a lot of material today, and I'm sure that you're going to want to go over all the good stuff and the items in the evac pack when you have a little more time and when you can do that on your own. And you also may have some questions. And if you do have questions that occur to you after I've left, then, you know, I'd certainly like to have you call me. At this point, you might give the person the card with your name on it and your phone number or a piece of paper or whatever that they could have. Or, as Nancy had said earlier, you could write that that down in some of the personal information area of the evac pack, so that they have it accessible to them. And then you might go on to say something like, of all the things that we talked about today, what do you think are the most important things for you to do in an emergency situation? And then really listen, you know, to what they have to say. And you can use, you know, prompts, and you can clarify as necessary. And for example, if a person doesn't mention the go bag, then maybe you might say something like, the go bag has been, a really important part of my own, emergency preparedness. And I've started keeping it in my spare bedroom, so it's always ready to go. And I refurbish it, and I kind of go over it every now and then to make sure it has in it the items that I know are going to be important. Something like that, right? Just to kind of give them prompts and go over and reinforce the things that that are important and that you think, given their own particular situation in particular, that you want to reinforce. Okay, Nancy, next. And as we've said here, if you haven't gotten through everything that you think is important to convey, or if the person has had a lot of questions and so it's taken a while to go through the meeting, or if the person seems like they have gotten a little tired and are kind of ready to wrap up the meeting, then see if a follow-up would be possible and desirable. We talked about that earlier when we talked about communication. If it does seem desirable to have a follow-up meeting, then be sure to establish the day, time, and place, and ask if the person would like to have anybody else present. Again, we mentioned earlier the fact that some people may have sort of emergency preparedness teams, and there may be other people that they'd like to invite to that, a neighbor, family member, caregiver, whomever. And make sure, if that's the case, that you know how to get a hold of those individuals and make sure that you have it worked out, how they're going to be contacted and who's going to do that. You also could ask where the person might want to keep their evac pack that you've been going through. And if they'd like to hang it somewhere and would like some help from you to hang it in an accessible place, then you can certainly offer to do that. And again, just make sure that the person knows how to contact you for follow-up questions. Okay, Nancy. So the end result of all of this is to jointly develop with the older person a personalized preparedness plan that would include the go bag, the evac plan, phone numbers, resources, assisting them with signups for warnings. And as we've said earlier, the older person really has to be invested in this plan. They have to be able to implement it effectively in an emergency, when basically they will more or less be on their own. They will have resources to call and to contact, but there are a lot of things that they will have to do on their own should an emergency happen. And as we all know, having a plan can reduce the stress and the anxiety that people feel in emergencies. And we think and hope that that will lead to safer and better outcomes. So that's it. I think that concludes our presentation. So I want to shoot it back to Priscilla at this point.